Our next speaker needs no introduction, but she absolutely deserves one. Today, we are honored to welcome a powerhouse in the field of performance psychology, Mugdha Bavare. Please give it up for her. She's a sports psychologist, founder of Mindsports, and a former national swimmer and a Shiv Chhatrapati Award recipient. She has worked with top sporting bodies like the BCCI, National Cricket Academy, Olympic Gold Quest, and has trained athletes competing at the Olympics, Asian Games, and World Championships. She also made history as the first sports psychologist to travel with the Indian women's cricket team for the 2022 ODI World Cup and the 2024 T20 World Cup. Woo! Please join me in welcoming the incredible Mugdha Bavare. Up next is yet another powerhouse in the world of sports psychology, Varadayini Gorhe. Please give it up for her. She's an ISSP-registered sports psychologist, founder of Mind First Performance Psychology, co-founder of INSPA, and a leading voice shaping how India thinks about mental performance in sport. With over 13 years of experience working with high-performance centers, young athletes, coaches, and even corporate teams, she's been building the system, ethics, and momentum this field needs to grow. She's a sharp, passionate, and a true force behind the evolution of sports psychology in India. Ladies and gentlemen, make some noise and help me welcome Varadayini Gorhe. The next one is going to be a short but a very strong intro. She is somebody who will tell you, I show, don't tell. So, Dr. Devika Patil, please give it up for her. She's a psychiatrist, sports psychologist, and Ironman triathlete. So, please give it up for her. Our moderator is somebody you're familiar with. Please give it up for Gitika Dubey.
Thank you so much for not introducing again. So it's going to be a pre and post lunch Gitika session, overdose kind of a thing. It's incredible how, it's very hard for me to understand how with a country this large and this efficient, in terms of physical strength, we are still at the tip of sports. I mean, we are just beginning sports as a culture in India. I will not take much of the time. Welcome to everybody. The first question is to Varadayini. Yeah. In what key ways does sports psychology differ from general psychology? And what is the career pathway to becoming a sports psychologist in India? And what kind of training, qualification, on-ground exposure, field exposure that is basically required?
Okay. Hi everyone. All right. Quick 3 questions. I might take some time to answer, but firstly, sports psychology, as a term says, I would like to ask everyone else, what do you mean by sports psychology when you hear the term sports psychology? Just a quick answer from someone.
How to work with the athlete's mind.
To work with the athlete's mind, okay. Checking on their mental health. What else?
Deal with wins and losses.
Wins and losses, yes, okay.
How to optimize performance.
Optimize performance.
Looking at an athlete for more than just an athlete, but also as a person.
Like a holistic perspective, right?
Win in the mind.
How to win in the mind. All right. So we've got answers right from mental health of the athlete to winning and losing, right? Performance. So as it says, we deal with both the elements, which is the mental health aspect of the athlete or of the sporting ecosystem, but we also work specifically on the performance side of things, which is the performance parameters that work from the mental mindset aspect, right? More leaning towards that side, but of course, you know, when we get clinical cases, then we have someone like Devika who can also cater to, you know, the clinical side of sports psychology. So that is the prime difference. It's not just limiting to counseling in closed doors in front of, like, you know, the athlete being here, I being here, and just a table in front of us. But sometimes it goes to counseling them in the locker rooms, on field, sometimes maybe at the sidelines, you never know, all right? So it's one of the rare fields wherein we have sessions which are outside the counseling room, all right? So a lot of ethical concerns that can come up here, right? I'll come to ethics later, but coming to your second question, I think from a training perspective, it's as a very simple bachelor's, master's ideal, okay? Of course, supervised practice is something what I always advocate, and that is something what I feel, is upcoming right now, even in the field in India. We really need to have supervised practice because it's not an easy field to start your work in, right? You need someone to guide you. So definitely education pathways, bachelor's in psychology, master's ideally in sports psychology. If not, then at least a specialization in sports psychology like a diploma, post-year master's is mandatory. Yeah, that's the educational pathways. And your third question was related to
On-ground exposure.
yeah, I mean,
What
I think
kind of on-ground? I mean, what the question is trying to ask is, should you also be an athlete to be able to understand the
definitely.
basics?
I think, I think someone asked me here, I'm not an athlete, but can I get into sports psychology? You can, but start being an athlete now. That was my answer to her. It's never too late to become an athlete, all right? The only, I would say, the main advantage of being an athlete when you are a sports psychologist is definitely understanding the athlete's perspective, right? Like you step into the athlete's shoes, and it's definitely a very important part of being a sports psychologist. Yeah.
Wonderful. Did you all notice that all three of them are sitting upright? Did you just notice their posture? They really don't have to tell you that we are athletes. They are visually athletic, right? All right. The next question is to Mugdha. How do sports psychologists support young athletes dealing with pressure, competition, stress, performance anxiety, especially across team games or individuals, different formats?
Yeah, I think I'll just add something to what Varadayini has said on the similar lines, especially when we are coming into the field of sports psychology. One of the things that we really have to keep in mind is, because the question was what's the difference between sports psychology and psychology, basically the foundation is same, but what is slightly different is the goals as well as the methods that we use. Of course, the second aspect to that is we play dual roles. As psychologists, we also take care of mental health, because that is what I have been doing when I travel with the teams. And the recent examples that you all have heard about the World Cup, or which you all keep hearing about, the mental health, that is what as psychologists we handle behind the screen. That is one of the roles. The second, of course, is performance enhancement, because when we are working with athletes, it's not only mental health. I mean, I have umpteen number of examples which I can share with you all, the kind of impact a pressure not only on the ground, on the field, on the court can have, but anything that is happening behind doors, in the sense with the families, with their personal life, all of those also create a big impact. So that is where we take care of the mental health, but of course the performance enhancement is also our role that we play, and that is where comes in, as I said, our goals are different. If we want the team to win, like what we saw in the World Cup, so we have certain things that we have to put into the team, something like how to bring that bonding, how to bring that unity in the team, how to create that psychological safety in the team, all of these factors that we do work with. So as sports psychologists, these are the two roles that we of course play, and that's the reason why specialized knowledge and specialized education is very important. Your base as a psychologist definitely helps you a lot. Coming to your question, how do we help athletes, the younger ones or as well as the elite athletes? The difference is elite athletes have, especially when it comes to the mindset, and that's a big challenge when we are working into this field, because when I work with Olympians, when I work with set athletes who've been in this field for last 10, 15 years, they have developed a certain way of thinking. Their thinking patterns have already been developed because they've been training maybe at the age of 5 they have started, and now they have reached Olympic level when they are around 20, 25. So they have developed a certain way of thinking. Now a challenge for us, for these athletes, is where we have to make them unlearn, and that's the biggest challenge for us, make them realize why it is an unhelpful way of thinking, and then set in certain right patterns to think. It's a challenge for them because acceptance is very low at this level, and it's a challenge for us because it becomes very difficult for us to do that. Giving an example, when I started working with, I'm sure all of you all have watched Dangal movie. Yeah, so when I started working with Fogart sisters, they didn't know anything about psychology. And the first thing that they said is, iski kya zarurat hai? Uthak baithak karo, hum theek hai, medals to aa rahe, right? But then it took me 1 year, literally 1 year, to make them educate about how mind functions, what's the role of it, and how it impacts the performance. So when we are working with elite athletes, this is the kind of a little tough job that we have to do. But with younger athletes, it's a kind of, we're just molding that pot when the training is also happening, when they're actually getting grilled into their skill training, fitness. We also include the mental aspects into it, which is, it's not easy, but it just comes into the system. So one, we have to make them understand certain concepts, and the first thing that we have to tell them is, yeah, skills are important, your fitness is very important, but along with that, the way you think, I mean, the simplest way of defining sports psychology or mental training is the way we think, right? So the moment they understand that, and then we give them certain examples, how the pressure, how you're nervous, being nervous at that moment, how it impacts their performance. So we have certain techniques to work on, we have certain goals to look forward to. So this is how especially we work with the younger athletes. So yeah, another thing, I'll just take 1 minute. See, every individual, every person is different. That is what we've learned even in psychology. The same rule applies to athletes. I can't give one technique to 100 players, the same technique. I have to moderate. I have to change the techniques and give it to them. That's another role that we play as psychologists.
That's wonderful. I'm reading a book it's a thick book on sports psychology, just because I have interest in sports biomechanics, but I'll tell you the name of it. It's a foreign author and I don't remember the name. But it's extremely interesting on how just a tweak in the way you think can enhance your performance many folds. I mean, you should all go back to the book that I have. I'll share the name in the public platform. It's very interesting with the case studies and stuff, how a little bit of tweaking can just change the ball game of the performance of the team or the athlete or anybody. Generic question to all three of you. Is it true that sports psychology is the highest paid field in psychology? This is not
I think
me
our smiles would say it all. I think anyone who can.
I would say no.
Yeah.
I mean, I'll base this premise on currently, if you look at the sports ecosystem in India. Okay, I'll base it on two premises. Chalo. One is the sports ecosystem in India. I'm sure you've read stuff. You've seen how athletes live. You've seen how much of finance goes in, say, the infrastructure and so on. Although I think things are getting better over the last few years, but I still feel there's a lot of scope for improvement from an infrastructural standpoint, firstly. Okay, then comes like us. You know, I tell this to everyone who wants to even pursue the field. We are just a piece of the jigsaw puzzle that an athlete builds. Okay, it's just one bit. Okay, we are not their minds. We are just, one person who possibly plays like a catalytical role in their lifestyle or in their whole life. Okay, so yes, that one question, I think it has two hidden questions also. One is it, because of the fame you want to get into this? No, we are no one. I will also say that we are literally no one. The athlete is who we are working for, right? Second question, definitely I don't think, I was just on my way from Pune, I was just asking Gemini, comparing like salary structure of entry-level sports psychologists in UK, in US and in India, and I saw the difference. Can anyone just guess the difference? Yeah, it's almost 10 times, okay? So like an entry-level master student who starts like working with, say, the government or, it's per annum someone's getting around about 3 to 5 lakhs in India, rupees, right? Just make it 10 times, and that's the entry level in the US or the UK. All right, so clearly, I guess not in India for sure at this moment.
So I think it's because we're just beginning to address sports as a thing also, probably because of that.
Yeah, it increases, of course. See, now, me being in this field for last 2 decades, I've seen quite a big change coming in. I'm not talking only from the monetary perspective, but the recognition, the kind of importance that the field is getting, that's great. And especially, the question that you asked was, of course, it all depends on at what level you are working once you get established in the field. Like, for example, if you are working with big organizations like BCCI, I'm not saying it's highly paid, but yeah, I think you can expect a better pay when you start working with these big organizations, but the start has to be somewhere at the bottom. I mean, those of you who are planning to take up this field, the growth is very slow. It's very steady, but I think the first thing, because I come across many enthusiastic psychologists who say that, we want to get into the field and we want to start working with elite athletes. Great, I mean, that's, I think, a big goal that we have to keep in our mind, but I think the start has to be somewhere from the grassroots. So over there, if you say the pay scale is really low.
Nice. But I think that shouldn't discourage you from getting into it. It's very fascinating.
Yeah, not at all, because I think one thing what actually has to carry you ahead, and I'm sure both of you all will agree here, is the passion. You need to be a passionate sports enthusiast who really wants to see the benefit for the athlete and not for oneself.
Yeah. All right, Dr. Devika, you have completed some of the toughest endurance races in the world and are currently India's second fastest Ironwoman. Oh my God, I'm already envying you. As a psychiatrist, what made you move towards sports psychology, and how has being an elite athlete yourself changed the way you practice and connect with the athletes you work with?
Thank you for the questions. I'll start with the first one. So again, I get asked this a lot, that you being a psychiatrist, why did you, do sports psychology? What made you do it? So I think the only answer I have for that is, why not? I mean, literally, why not? And I think the driving force behind that why not comes primarily from 2 places. First is, since I was a teen, I got into endurance sports. So I used to do ultra running, ultra cycling, but that was more like at a very recreational level. Since the past 3-4 years, I have been doing competitive triathlons, where I have set targets, I plan ahead, I have a structured training and everything else. But in my younger days, when I didn't know what sports psychology is, or I was a very naive athlete to say. So there, through some of my races, I started realizing that I might not have the mental strength to do some very humongous events. So in 2015, I did an event called Paris-Brest Paris. That is a 1,200 kilometer ultra cycling event. And though I was the youngest female to do that, Indian female to do that, but still after a point, after I crossed like 1,000 kilometers, I did start to realize that I didn't have the mental strength to just push myself ahead. Of course, there were various other things as well. But I think that's where, as an athlete, I started realizing that, no, it's not just physical. If I want to go ahead in this, and if I want to do this for my whole life, then definitely I myself have to work on my psychology, on my mind as well. This was the first part. The second part is related to when I was doing my residency as a psychiatrist in Mumbai itself. So I was always interested in, where does psychiatry and sports interconnect, or where do they meet? Again, there was nothing called sports psychiatry as such. I mean, I had heard that, okay, it is something that is there in the Western world and all, but nothing in India as such.
but I was always interested in finding out how this intersection looked like. And that's how I started reading about it, finding out that can I do any kind of certification course or something else. And luckily I was able to do that. I did a few certification courses in sports psychiatry. And then I realized that even as a psychiatrist, I mean, my approach is a bit different. I don't definitely rely just on the psychopharmacology, but a lot also on therapies, or how do you help an individual beyond the medication part itself. So that's when I thought that, okay, if I'm trying to gain my expertise in sports psychiatry, why not sports psychology as well? So, and again, just as few things worked out, I was facing a challenging situation in my personal life, which gave me sort of a breather in terms of my work as well. And that's when I decided to do my master's in sports psychology. So yes, at the end, I would say psychiatry and psychology are classifications that we have made so that our functioning is easy, so that our roles are defined. But we all know that it doesn't exist that way. It's all related, it's all tied up. So yes, if I can, so yeah, that's what. Why not? Why should I limit myself to a certain set of skills? So that would be my answer. Second thing, yes, my learnings as an athlete and how does it apply to my practice. So I think one of the key things that I've learned in my journey as an athlete is you always have to, especially an athlete who's also working, so I'm not a professional athlete, but I do this just out of my passion, is that you have to constantly keep a balance. And that balance might not be a very static thing. It's not that, okay, I give 2 hours to my training and then 6 hours to my work. It is very dynamic as well. Like depending on the situation, depending on what kind of work I'm doing, time availability, everything else, I can allocate different things, different times to each activity. So I think that balance is always very dynamic. And it also reflects on the way I deal with athletes. I mean, instantly when they hear about, okay, I also do triathlons, I'm into this. So I think that relatability factor just comes up. So they don't see me as, okay, ये तो chair पे बैठ के क्या ज्ञान दे रही है types. They feel very relatable. And I think another important thing is you're also able to understand how they react to pressure and how are they coping to stressful situations. Because sometimes what they do might not make sense to you. Or sometimes when you know that, okay, this athlete is struggling, but still they have certain demands placed on them. So be it like they have to compete in some event or their trials are coming up. Then again, it becomes a very difficult decision to, okay, do you go ahead or not in a state where their mental health is compromised. So I think there you are really able to understand that why this pressure is coming to that athlete. So yes, I think that's about it.
That's
Thank
a wonderful
you.
insight. That's a wonderful insight into the importance of having a sports psychologist, also being an athlete, and also having the understanding of the psychopharma side of the brain domain, if we have to talk about. All right, the next question is for Varadayini. What ethical dilemmas arise when athlete well-being clashes with performances, expectations from coach, team and parents?
Yeah, I think one of my favorite topics. Yeah, I think like I said earlier as well, there are potentially a lot of ethical dilemmas that can arise from our practice as being sports psychologists. Like I said, the first thing is we don't practice in traditional setups most of the times. We are also consulting with athletes outside the office. right? I think that's one of the biggest, I would say, ways in which there could be ethical dilemmas. For example, like Mugdha said, traveling with the team. That is one of, I would say, again, another areas wherein you might have a lot of ethical pitfalls that could come because you're traveling with them. You're literally staying with them. There are sports psychologists who are residential sports psychologists. You're staying with them. So your role is again, multiple roles can come by. You're a warden sometimes you're their parent, sometimes you're, multiple things can happen. And at such times, it's very important for us as sports psychologists to reflect on where this can go beyond professionalism, right? Because you don't want athletes forming, emotional bonds that go beyond professional boundaries. And there is a high chance that it can happen. But if the reflection is stronger, the sports psychologist can manage it better. And I think Mugdha can also highlight her experience because she's traveled with teams extensively. Secondly, speaking about coach and parents especially, we interact with a lot of parents, coaches, multidisciplinary staff, and I think the earlier two panels, especially the school panel as well as even the geriatric panel mentioned a lot of interdisciplinary work. We do a lot of interdisciplinary work also, and I am someone who pushes for it, although there are issues like confidentiality that come by. But having said that, I think if confidentiality and other ethical principles are put upfront onto say the academy or the setup that you are in, I think the whole working becomes easier, right? So for example, you break confidentiality on certain times, like especially if suppose an athlete comes to you saying that I have used a performance enhancer that is banned by WADA, for example. Is this a time where you're going to keep quiet and say that, oh, I'm not going to tell this to anyone, or are you going to discuss this with the coach? This is something what you need to make very clear in the get-go, like at the first time of an engagement wherein you're signing a contract with the team. It's very important to have these ethical dilemmas and ethical codes set up in the system, even when you're working privately. Now, this is something what I think a lot of us have learned through the years, saying that, okay, when you're working with parents, you're working with coaches independently in your private practice, it's good to set the codes, on the first session itself, saying that, okay, if suppose these things arise, this is what is going to happen. This is what my ethical codes, tell me to do. And you're very clear from your end. Okay, so tomorrow if something like that arises, you know what to fall back on. So henceforth, all this to set up, you as a practitioner need to be very clear on your ethical codes of conduct. Because unfortunately, and I think we are trying to do this through the Inspire Sport Psychologists Association as well, trying to get the codes of conduct rooted into Indian cultural context a bit stronger. We can definitely rely on other sports psychology associations across the world who are more established, and set your own codes of conduct as well, because that is very important for us as practitioners to have. Yeah.
Right. So, I mean, there are a lot of gray areas yet, which are, I think, with experiences, you explore and you define your line.
Yeah. One thing I'll just like to add, since she said, because I do extensively travel with the teams, I think it's very important that we set our boundaries first, because when I work with many organizations like the big names, the first thing is I have my, all my ethical codes ready, which I share with the organization. And now I think because I've been working with them since a very, very long time, they know and they don't even expect more than what I do. But yes, I mean, how the communication is going to be with my athletes, where am I going to sit and do the sessions with them. Third most important thing is, because of course, see, all of us are curious as to what is happening in another person's life, and obviously organizations like BCCI or even Mumbai Cricket, everybody, they just want to know from the good side of it, I would say they want to know if they need to do anything else for the players. But then that is again where we have to stop, because we cannot share anything that is shared with us by the players. So that is the confidential part that comes in, and we have our rules set out there that no reports, no comments, no conversation will be discussed outside the room, outside, wherever we are having sessions with the players. And the reason behind that is, of course, it's ethics. And second, it's the player who feels comfortable and they feel that we are at the right place, because a person who is sitting in front of the player is non-judgmental. And secondly, very, very crucial, that information is not going to go anywhere else. Yeah, because see, this field is so sensitive, especially when I'm talking about team events. If the player is benched, right, that person is going through a lot many emotions which they cannot get up and tell the coach, because you really don't know how the coach would interpret or how the support staff or the organization would interpret that. The only person that they have behind the scene is the psychologist, and that is where we have to respect. And that's where, if we set our boundaries right in the beginning, I think that becomes an easier job for us to get into the field.
Right, that's very interesting, because we don't think about the mental health of the one who's benched. So it's very important. But I think it's again a very growing and exploring domain, even for you people, that where to draw the line, even as the ones who are practicing and giving them some sort of aid. Dr. Devika, where does sports psychology, psychiatry fit with the performance ecosystem? And how can the psychologists and psychiatrists collaborate to support athlete?
Another very pertinent question. That's something that we have been discussing since a while. So, as Mugdha and Varadayini said earlier, that performance enhancement can't exist without a state of psychological well-being, right? Because when you talk about performance enhancement, you definitely work on building certain set of skills in the athlete, but at the same time you also have to think beyond the athlete and think of that individual as a whole, because at the end of the day their holistic well-being matters much more. So that's where sports psychiatry steps in, because when we talk about mental health, we know that it doesn't exist in a binary. It's not like, okay, this is bad mental health and this is good mental health. It exists on a spectrum. So at one end you have mental health related disorders, which then moves to distress or psychological issues, then a state of well-being, and then at the end you have self-development, growth, or something that for athletes like performance enhancement or flow state. So it's a spectrum, and that's where the role of different professionals come in. So especially when you see that an athlete is struggling, is showing certain signs and symptoms. So it can be beyond the expertise of a sports psychologist or a clinical psychologist to deal with those issues. So that's when the athlete might need the help of psychopharmacology. Again, there are many myths, many misunderstandings regarding when it comes to the use of pharmacological agents for athletes, because most of them think that no, it only causes side effects, or are they banned by, or are they considered as in the anti-doping laws? But again, most of the molecules that we as psychiatrists use for conditions like depression, anxiety, so most of them are very safe. Yes, safe in the sense of with related to the doping laws. There are certain substances that are not allowed, but again, that is also where, as psychiatrist, you need to have, if not a certification, but at least an understanding of sports itself is very important. Again, you need to know that, okay, if you're giving an agent that is not allowed in the competition, then do you need a therapeutic exemption for that? Or what is allowed in the competition, what is not? So yes, that is related to psychopharmacology. Another thing which I have noticed when I work with athletes is that certain molecules do have certain kind of side effects, and as athletes, physiology is different. So you might see these side effects quite early on, or the risk of seeing certain side effects are more. But again, that is also where you have to be very careful right in the beginning, because as we all have been speaking about today, is that you need to have an individualized approach. So I need to understand that, okay, what are the physical parameters of these athletes, like BMI, weight, heart rate, BP, everything else. What is the, let's say, blood work? So is there any kind of deficiency that is already present? And then ultimately, what are the demands of the sport itself? So suppose if I'm giving a kind of molecule to the athlete that is going to make him drowsy, that is, or has the tendency to cause weight gain, then definitely I won't be prescribing it to somebody who, who is very active or who is in the competitive season. So these are the things that I need to be careful about. And then eventually also explaining all of this to the athlete, to his support staff, is equally important, because again, that misconception exists everywhere. So again, here the collaborative approach definitely comes into picture. Again, one kind of change that I have been seeing is that I have seen sports psychologists referring an athlete to me, which I guess was not the case previously. But now even I think we all are realizing that we can't work in isolation, and it is essentially a teamwork to go ahead.
That's wonderful. So many aspects of sports psychology are coming into picture right now. Last and final question. What will it take for India to build a strong professional ecosystem for sports psychologists? What pathways or partnership? I think you've covered the pathways in partnership, so we can talk about INSPA. What is INSPA, and you can tell the audience about it, and how can we restructure the ecosystem here in India to promote more of sports psychologists?
I'll quickly just give a background on why we started INSPA Sports Psychology Association. We already have Sports Psychology Association of India, but I think the one difference, this is something what Rupa and I also have been speaking about, is protecting the title of a psychologist. And whereas the other association has a lot of physical educators who also become members. Again, that's something which again a very blurry line in our field of sports psychology. But I think being psychologists, and I think in the previous panels also, like everyone mentioned, the importance of having the foundation, and Mugdha also just reiterated that the foundations of psychology is very important, and I think protecting that title is equally important. So we also have people who have done like a 3-month certification calling themselves psychologists, who exists in our, sports psychology ka 3 mahine ka course hai, and then I've done that and I've become a sports psychologist. Okay, we also have people who might have got bored of their earlier careers. Good that, sometimes, some people actually want to make switch, but do it the right way. I think today I can't sit here and just do a 3-month maybe dentistry course and become a dentist, right? It's the same thing like what what we are trying to promote through INSPA. And it's not about this is right or this is wrong. Life coaches have their own thing. Even mental conditioning coaches, as a lot of people have their own thing. But that doesn't make you a psychologist, is what we are trying to say through INSPA as well. The second question, I think stronger pathways or stronger professions will develop once you start developing stronger SOPs, right? What is your standard of practice? I think I spoke to a sports lawyer, and this is what he told me. He's like, start a good standard of practice before you make it a law, right? You can't overnight law to nahi ho jata hai. First thing is like, have a standard of practice which sets up your system properly, which will eventually say, decades later, you'll say that, okay, this is the legal system, you need to become XY. If you want to become a sports psychologist, you need to undergo this pathway. And that's what we're seeing in, say, the US, the UK, or the developed countries wherein sports psychology was, there for such a long time, right? That's something what we want to try and do, and hopefully pave like a foundation there. Secondly, I would like to talk about supervised practice, because that's something what I feel in any field, I think everyone will agree here, is somewhere lacking apart from, I think, clinical psychology. We need that push to have, like, I think in the US, if I'm not wrong, a sports psychologist needs to undergo at least about 1,500 hours of supervised practice before you call yourself a sports psychologist. All right, यहाँ पे masters के बाद you can call yourself a sports psychologist, which is like a thing, like it's okay. But I think that is something which again needs to have a lot of weightage after your masters also, the requirement of a supervised practice, so that you have someone to fall back on, you have someone to refer in case you are going, because like we spoke earlier, our field is very vague, abhi. We don't know what is, what's right, what's wrong. Should I tell this to the coach, should I not? Should I share this with the parents, should I not? All these things are so vague. We still need someone who's been established, who's at least worked for some years to, fall back on. And I think that's why supervised practice is something what I guess would be one of the first goals from the association as well, and I think for the community benefit as well.
See, somewhere I think the strict rules have to be laid down, especially when we are looking at something like a new sports psychology as a new field, because when we are there working with the athletes, as I always say that, it's a very sensitive area that we are working in. We are working with the mind of the player and the athlete, and one word, one sentence can either make a huge difference or can make the athlete collapse at that moment. And that's where we need to have, a good training facility. More than that, a good background and a good foundation. And that's the reason why psychology and doing masters is very, very important, because in masters we do have, and that's what we were together when we were doing masters and graduation, we have practicals. We've learned how to communicate to our what we call them as subjects. We know how to give eye contact, we know how to build those contacts, how to create that communication, how to speak to a person, how to be empathetic. And all of these, maybe back then when we were students, we really didn't understand the importance of it. But now when we are in this field and we are sitting across the athlete, it becomes so very important, because the kind of communication and that connect that you build with your players will stay for a long period of time, and they'll keep coming back to you, because I have my players who are there with me for around 13-14 years now. So it's not, see, sports psychology is not a short process. It's a long-term one. It's a process. It's not that we solve and resolve their issues in 5 or 6 sessions and they start performing wonderfully. They're going to go down, come up again. So they will need our help time and again. So when we're looking at education, it becomes a very, very important part. As Varadayini said, just doing a certificate course, because again, I have so many examples to give, where the athlete's life was at stake just because someone else who didn't have such a kind of a background actually made that person leave sport. So this is something which we don't want to happen, which we don't want to let it happen in our field, because as I always say that it's, see, whatever in the field of psychology, sports psychology, all of us are dealing with individuals. We are dealing with their minds. So we have to be extremely careful to the kind of language, to the kind of, connect that we build with the players. And that's the reason why the system has to be extremely stringent, very, very strict.
That's so cool. That's so cool. Anybody with questions? I'm sure a lot of people with questions. We'll take 1, 2, 3 questions. We start from there.
Hello, thank you. So to me, performance psychology seems very performance outcome oriented. I'm curious to understand whether unstructured modalities play a role in the work that you do, and whether there's a pressure to use more outcome oriented processes compared to something, say, unstructured like narrative.
Yeah, just to whatever I have understood, the kind of questions that you've asked is, of course, at times we do have to use unstructured practices. I mean, as I said earlier, there is just no one jersey that fits all. Like so many of you all sitting over here in the hall, if I have to use, maybe people think that sports psychology is only visualization and meditation, but it is much, much beyond that. I think that comes a little later. But just for an example, if I have to use maybe a visualization technique, it would differ from person to person, because it depends a lot on, one, the thinking pattern of the player, second, the personality of the player, and third, how they would react to a particular method that we are using. So we cannot have very, very structured formats, especially it becomes a challenge again for us when we are working with teams, because now when I travel with the cricket teams, there are 11 players who are playing. There are people who are sitting outside. So the entire team, that is 18 players plus the support staff, is what we have to handle. So every player's, the way they are looking at the situation differs, and the kind of methods that we use, the kind of tools that we use is going to be a little unstructured. Secondly, when we are traveling, for example, either I take sessions maybe on the ground, I'm taking it on the court, I'm taking it somewhere in the room, or we just go to a cafe and take a session. Again, it's really, really unstructured, but that all depends on the player, what he or she wants. Yeah, so it's very unstructured, but then it's in our hands how do we take it and how do we give a structure to that kind of a method. I hope I've answered your question.
Hi. So I'm a school counselor, and now we know how much of sports is of importance in the school community. The school that I work with has a lot of national level players and athletes. So can you shed some light on what is something we can do within our capacity as a school counselor to help these student athletes?
Okay, just one thing, I have developed a program which is called, I always look at sports because I've been a sport person for almost 16, 17 years of my life at a competitive level. And I always say that, when I'm working on this side of the table now as a sports psychologist, sports has taught me a lot many things, yeah? And that is what I had that in mind for last so many years, and I've come up with a program which is called a life skills program. So when we talk about sports, especially when I talk with parents, they always think that sports meaning winning or losing. Yeah, so I take them beyond that, and I explain to them it's not winning or losing, because that's something which is not in our control. But look at the kind of skills that a sport teaches. And I go from school to school where we do these life skills programs for kids, and what are the benefits when they are into sports. Like, for example, how it helps you to develop your confidence, your focus, your concentration. If you actually look at sports people, 90% of my athletes whom I train are toppers in school or colleges. I mean, that's again a myth that if you are into sport, because we are just average in school, that's the reason why we have taken up sport. It's not that way. So this is the kind of thing that maybe at a school level somewhere we can start doing.
Just want to add one thing. I think a lot of our work is based on motivation. Like, I think it's a popular thing also, but it is factual as well. Like, theoretically, there's a lot to do with the drive that the athlete has, right? And by athlete, I mean even a student athlete. Anyone who plays, anyone who moves is an athlete, okay? So it's, that is definitely something what we can say. But the achievement motivation of the athlete can be considered. So as a school counselor, I think even if, if there's any kind of assessment, if there's any kind of sessions that you'll have with the athletes, one topic that can be spoken about is there's this famous theory which speaks about ego orientation and mastery orientation. So, we lean towards developing the athletes more mastery oriented, who's like, take each day as it comes and develop one day at a time. So developing that kind of a mindset is very, very important in athletes for a long-term perspective. So something like that could be included in any sessions that you do with student athletes as well, wherein, promoting mastery orientation when it comes to motivation is very important compared to like a comparison kind of thing, because comparison always gets highlighted in sports, right? You are better than the other person and so on. Rather than that, how can I better myself from what I was yesterday? So some topics like this could definitely help, student athletes as well.
Yeah, hi. This side. Hi. Okay, my question to you is, you mentioned some time back, you had also, you did throw a question as well, what is sports psychology? So for me, it would literally mean psychosomatic wellness. Now, having said that, we know that sports itself requires a lot of discipline and a routine which is set over a period of time. My question to you is, how do you handle, and in case if you've had a case like this, would you like to share a case study where you've met Paralympian? Because, you know, handling them is absolutely difficult. Because to set a routine and discipline for them probably would be challenging, and it's what are the obstacles that you may have faced as a therapist or psychologist, and how did you overcome or combat those challenges or obstacles?
So yeah, I do work with Paralympians and I travel with them as well. I think to be really honest, the difference, because I work with able-bodied as well as Paralympic athletes, and to be really honest, they are extremely strong mentally. So the kind of, maybe at times, the kind of challenges that I face with able-bodied, it's so easy for me to work with them. One, because they are aware of their body. Second, they are aware of their limitations. And third, they are aware that, yes, I mean, I have these limitations, so what can I do? Considering all these limitations, how do I have to perform? So, and second, again, this is what my observation with them is, we can't really look at them as para-athletes. I mean, they are very, very sensitive about it. So when I'm talking to them, when I'm working with them, it's just any other able-bodied individual that I look at, rather than looking at them differently. In terms of routines that you have said, I think looking at able-bodied as well as para-athletes, the discipline part, the routines, the pre-performance routines, during match routines, they're almost, I think, at an equal level. Yeah, of course, we look at Paralympic athletes because they have different categories. They are wheelchair-bound athletes. They are, you know, at times, they maybe they don't have one of the limbs. So the categories are different. But when it comes to the routine, because see, ultimately the goal is the same, that they want to achieve a medal and they want to make the country proud to do that. So when it comes to discipline, I really had no issues at all working or maybe literally being behind them, that this is the kind of routine that you need to follow because that's going to help them. Of course, unknowingly they are doing it, but from my perspective, I just make them realize that the importance of routine, why it is important, and what's the impact that it makes in their performance. But I think overall, I mean, it's brilliant to work with para-athletes. In fact, I say that rather than me helping them, they have helped me a lot to understand so much about, you know, lacking on so many things in terms of your physical conditions, still you can be there, you know, perform for your country and make the country feel proud. So we get to learn a lot about from these Paralympic athletes.
Wonderful.
Yeah,
Please.
sorry, to add to that. I personally haven't worked with a lot of para-athletes, but a few of them who I've worked with, definitely what Mugdha said is that they are very driven. I mean, I guess it also comes from the fact that before sports as well, or besides sports as well, they know what kind of struggles they have faced. So maybe it can come from a like social perspective or from their families or any like closed ones, because the perception that we have about differently abled individuals as such is very different, and we tend to look at them from a different perspective altogether. So I think they are quite aware of this fact, and that is where I think their struggle starts, even before the sport itself. So I think because of the awareness that they have, I think in some individual that just strengthens their drive to, you know, perform or go ahead, excel in their sport. And secondly, just sharing a athlete that I'd worked with, she had deafness, and again one of the problems that she was facing was whenever she used to go in places which were cold, where the temperature like used to be below 20 or something, sometimes it would trigger her ear infection. So again, somewhere it would affect her performance, because once the infection is triggered, she would not be able to, she would require medical assistance, and then she would have to pull out of the competition. So here again, definitely the infection part was something that was medical, but again, the way that she was dealing with it psychologically, like a certain kind of fear had already been induced in her mind because of previous experiences. So I think this time what we did was we tried to sort of change the perception that she had through, again, using certain kind of skills, particularly visualization, where she was able to, handle or tolerate that kind of cold or that kind of condition in a better way. So she was at least able to face it rather than having a sort of avoidance approach. So yes, I think working with them, as Mugdha said, that teaches us a lot, certainly.
Yeah, they are very high on grit. Because since they are the para-athletes, you never know. I'm talking about the Paralympic players, because it happens every 4 years. So whatever I have to do it now, because 4 years down the line, I really don't know, because there are so many injuries and so much of a risk to their health is also involved. So when I look at them and when I rate them on the grit aspect of it, they are extremely high, extremely high.
That's wonderful. Such an insightful session. I hope all you guys will first pick up some format of sports, start moving for that matter. Sports psychology is, of course, your choice if you are interested deeply in sports. Thank you so much for that lovely session.
Thank you. Thank you.
We will just give certificates.